Hello and welcome to today's Social Media Live. We are going to be joined by a really exciting panel from all over the world. This year's World Health Day will kick off a year-long campaign focused on maternal and newborn health, titled Healthy Beginnings, Hopeful Futures. Today we have guests with us who will midwives from different parts of the world who will share their experiences and challenges, and we will talk about the role of quality midwifery. Let me introduce our guests today. We have Edith Gicheha. She's joining us from Kenya. We have Deborah Lewis, who joins us from Trinidad and Tobago. We have Ulrika Renstrom, who is our technical officer here in WHO Switzerland, joining us from Geneva. And we have Neha Mankani, who is from Humanitarian Engagement and Climate advisor from the International Confederation of Midwives, and she's joining us from Karachi, Pakistan. So let me start with the first question for Neha. Neha, what is childbirth like in your country, and what are the challenges around access to healthcare?
Thank you, Leah, for that question. So, Pakistan is really interesting, the healthcare context over there, and it's similar to a lot of South Asian contexts. So, what's interesting is that the childbirth experience now in Pakistan has become quite medicalized. So, there is a lot of reliance on hospital settings and interventions, particularly in urban areas. But with this medicalization, there's also a lot of dependence on cultural norms and traditions that are very different across Pakistan. It's not homogenous at all, and that includes birthing positions, postpartum rituals, and also access to healthcare infrastructure is quite diverse. So there's advanced medical technology in private hospitals. There's basic maternal health centers in rural areas. There is still a very big reliance on traditional birth attendants and home births in rural areas as well, not always with trained midwives. Then the other thing is that the healthcare system has various levels of healthcare professionals. So we have lady health workers, we have lady health visitors, we have midwives, we have different levels of doctors and specialists. So the access that women have to care in their pregnancy depends on where they are, what their financial situation is, what their family context is, how much mobility they have. So all of these factors affect. And the other thing that's really interesting, again, I think similar across South Asian contexts, is that there is a very big reliance on family support, particularly from mother-in-laws, from mother's extended family, and that remains paramount during pregnancy, childbirth, and beyond. And it's a really big part of how the childbirth process is perceived in our culture.
Okay, thanks, Neha. We will again circle back on this issue. And I also want to remind our audiences tuning in that if you have questions for us, you can use the hashtag AskWHO, and my team will bring me the questions. And I hope some of your questions will be answered on today's live. So, with that, I'm coming to Deborah. Deborah, what is the reality of childbirth and how painful is it? And can women and their partners really prepare for it from your experience? Over to you.
Yeah, thank you for that. Generally, most people would describe it as painful. However, to be clear, the experience and so therefore the intensity varies significantly between people and even between pregnancies in the same person. And can you really prepare for it? Absolutely. Preparation is vital. The preparation, though, must start at the beginning of the pregnancy and continue throughout. So the first thing that you must do is choose an appropriate and supportive care provider. Later on in the pregnancy, then the education and the information that is shared should focus then on the labor and the birth process, so that you can understand the process better and understand what's happening. Many times the lack of understanding and education causes fear and anxiety, which then, affects the experience overall. But also, it's really important to learn how to cope, how to manage the process. people use different methods. There's relaxation and breathing and visualization, and there are different methods, but I think that they all work in a similar way, which is to shift the focus away from the discomfort or pain, as some people would call it, that you're experiencing. Usually with my clients, the example that I use is your body is trying to open to allow the birth, to allow the baby to come out. But a very normal reaction to anything that's uncomfortable or painful is that you close up. You know, you sort of tighten up and you close up. So it's a very normal reaction. What we're asking you to do is the opposite. So whatever technique works for that person is what they should utilize to allow your body to relax enough to allow your body to do what it's trying to do. So in a nutshell, having an understanding of what to expect and preparing for that, understanding what's happening, can absolutely help you so that you have a much better experience and you're much better prepared.
Okay, thanks a lot, Deborah. That's very reassuring to hear that a lot of things are under our control. Starts with the mind, of course. And I'm now going to come to Edith. Edith, if you're now back with us, there was a slight technical glitch, and I hope I'm completely audible to you. Edith, what are some of the most common questions and myths that you hear around childbirth? Would you like me to repeat that, or it's all good?
It's all good. I heard you, and thank you, dear, and the rest of the team, and thank you for having me. So we do get lots and lots of questions, and there are so many myths that we need to bust related to mother and child, especially around pregnancy and delivery. And many questions are like, moms like to know, how long is labor? Am I being rushed for C-section when I shouldn't be rushed for C-section? What are the signs of true labor? I don't have enough milk. How can I get enough milk for my baby? How can I take care of my baby? And these are questions which show us that moms are actually quite concerned about how they carry the pregnancy, because they do want to have a baby who is healthy, remain healthy themselves. So for the question about what are the signs of true labor, true labor has two things which you can think about. The contractions, which is the pain. We need to know what pain is it, and is it true? For true labor, pain, which is lower abdominal pain, and it usually will radiate to the back. So you will feel, for a mom, you will feel it on your lower belly, and it will radiate all the way to the back. It will be like tightening. And when you put your hand on top of your belly, you feel like it is tight, like a tennis ball, like something really hard. And it comes and goes intermittently. And as time progresses, you find that the pain, the duration of the pain increases, and the interval from one pain to the all contractions. Then the other one is we have cervical dilatation. So as that pain is happening, then your cervix is getting ready to open up so that the pain can now push the baby down and you can be able to then deliver. And this, for a normal mom, it can go even up to 18 hours from the time this process begins to the time it ends. So we should not be nervous. We should listen to our health workers. Let us go to the hospital. Let us explain how we are feeling so that we can work together. We are partners. Midwives and neonatal nurses who will be taking care of the babies, we are working together to make sure that you deliver safely. For the question about do I get enough milk? How do I get enough milk? I don't have enough milk. to make sure that as soon as the baby is delivered, and for us as midwives, it's our goal to make sure that as soon as the baby is born, within 1 hour, we have put the baby on your breast. And this will help to stimulate your brain to start releasing hormones to be able to create the milk that your baby requires to be able to grow. And so we need you to start breastfeeding immediately after delivery, even in C-section. Within 1 hour, we put the baby on the breast so that we can be able to, your breast can be able to create the milk that is required, both produce it and eject it from the breast so that your baby is able to get the milk. So after a few days, we realize that now we stop relying on hormones, and the more we put the baby on the breast, and the more we empty the breast, the more we get the milk. So now, after a few days of breastfeeding, you're going to see that the more you empty your breast, the more you're going to get milk. So for me, those are the main questions we get. Back to you, dear.
Thanks a lot, Edith. That was, you really described the whole process very lucidly, and it really comforts prospective mums and also women who are going through this journey of childbirth. I'm going to take some audience questions now. We have a question on X from Abdul Rahman, who's saying, with maternal mortality rising in some regions, could scaling up midwife-led care or tech-driven interventions be the key to immediate and lasting impact? So I don't know who from the panel would like to answer that. Ulrika, maybe if you'd like to answer that question from WHO?
Thank you so much, Dia, and thank you, listeners, for your questions. So midwifery models of care, it's a service approach where midwives are the main care provider, and they provide care during pregnancy, childbirth, and the postnatal period. And they can provide quality of care. So the latest evidence and research has shown that with midwifery models of care, we can reduce maternal mortality, we can save lives, we can also provide a more person-centered care to women and newborns. And we can provide a care that is more holistic, and that it's shown to be more wanted by mothers and pregnant women. So that's why WHO and UNFPA and UNICEF and other partners are collaborating to inform about transitioning to midwifery models of care, and also to provide guidance on this model of care.
I'm going to ask a question that is about what can women expect following birth, after they've given birth, and what are some of the ways to support a healthy recovery? Deborah, I'll come to you for that question. Over to you, Deborah.
Okay, thanks very much for that. The first thing I want to say is that we have to recognize that this is a huge period of transition. There's so many things happening at the same time. Quite often the focus is on the physical things, and the primary ones of those are the bleeding, the uterus contracting back, so you have some cramping, you may have some soreness in the perineal area if it was a vaginal birth, or abdominal if it was a C-section. Your breasts are becoming full. Edith talked about, preparing for breastfeeding, and there's a lot of fatigue caring for a newborn, because you absolutely do not get, continuous many hours of sleep. But I think we put less focus on the emotional changes, which I think are just as important. There are a lot of hormonal changes taking place, which can really impact your emotions. So you can have mood swings, anxiety, that type of thing. And coupled with the fatigue, the lack of adequate rest can make this, a challenging period. So how can we support it? as you said, to support a healthy recovery? Well, the first thing I think is that we have to plan for it in a better way. Quite often, families are prepared up to the point of the birth, but we don't spend a lot of time focusing on that period immediately after the birth. And I think that this is a period that really needs a lot of attention. So with my clients, what I do is we have long conversations about this. And one of the primary things I ask them to do is identify their support network, identify what that would look like for them. So somebody from their family, somebody from the church, a member of the community, whoever they think can be available to provide the support that they need to ensure that they're getting the rest that they need in that period. And it cannot be their partner. It doesn't matter how supportive their partner is, because I want them, the partner, to be able to bond with the mom and the baby as well. So I don't want them spending all the time doing the chores. But once you've identified that person or persons, you have to be really clear about what the support is that you want. I don't know about other cultures. I think it's similar though, but in this region, too often when people offer to help, they think they're coming to help hold the baby and bathe the baby and all of that. And that's absolutely not what you need help with. Babies feed and sleep. In the beginning, they don't really do much more than that. So you have to be really clear. Usually what I suggest is focus on laundry, house cleaning, but most importantly, food. Because I want you to eat regularly, on time, balanced meals. So resting every single time the baby is asleep, you need to be off your feet resting. It is not an opportunity to be doing things. And of course, the food. If for some reason they're not able to identify someone to provide food, then we talk about preparing meals ahead of time and freezing it. So the only thing you have to do then is heat it up. So just again, in a nutshell, resting, being well fed, but planning and being realistic about what to expect in that period and planning for it, I think really goes a long way to helping them cope better and helping ensure a healthy recovery.
Thank you so much, Deborah. I have another question from one of our viewers who's tuning in on Facebook. And she first starts by complimenting the amazing guests that we have on our panel. Maka is asking, what are the most effective ways to improve maternal and newborn health in low-income communities? Perhaps, Neha, if we come to you on this question, because you started the conversation talking about the context in Pakistan. So, Neha, over to you.
Yes, thank you. Thank you for that question. I would say, honestly, the biggest solution, the driver of change, is quality of care. It has to be, and it's always over quantity as well. We talk about midwifery. I represent the International Confederation of Midwives, and I am a midwife, and I say that midwives are such a big part of the solution. But even when we want midwives to be part of the solution, a really big part of what needs to happen is strengthening how midwives work and improving access to education, creating an enabling environment for them so that they're able to provide that quality care. So a lot of the work that ICM does and a lot of the work that I do in country with other midwives as well is around strengthening quality of care, so that, because when you want to increase access, especially in rural outreach areas, you need community level healthcare providers who can have last mile health services available to all women. So for me, the long and short of it would be quality of care and improving midwifery services.
I'm going to segue to the next question, which is a little bit about warning signs. What are the warning signs that postnatal women and families should be aware of in themselves and their baby? Edith, could you address this question for us, please?
Yes, thank you so much. And this is a very vital question. And like Deborah said, we need to make sure that we take very good care of ourselves as moms and the babies that we've just gotten. So having knowledge on what are the danger signs is going to prepare you to be able to seek the care that you require, and you need to do this promptly so that we don't get any complication. So for the moms, I can be able to list at least 5 which we are currently using in Kenya and in Africa setting. Heavy bleeding. If you give birth and you continue to bleed, then you need to go back to the hospital or to the facility where you got your help, where you got your delivery, where your delivery happened, and have somebody check what could be happening, because we're not supposed to have excessive bleeding. Usually after delivery, the bleeding will be between 300, 500 mils, and anything above that extreme, and this can even change based on the mother's condition. So after you have already gone home and you continue seeing red blood a lot and you're changing your pads very frequently, then you need to seek help at the hospital. If you have a fever would be indicative of infection. And so we need you to come back to the hospital so we can do a thorough checkup to see whether you have an infection in your body. Severe headache and convulsions. Severe headache and convulsions are associated with high BP, what we call preeclampsia and eclampsia, and sometimes we have some mothers who convulse even after delivery. So it is very important that if you're having severe headache that is not going away, then you need to come back for a review so that we make sure that you are and everything is okay. Foul smelling vaginal discharge. It should not be foul smelling. And foul smelling is something, even you, when you hear it, or not hear it, when you smell it, it's almost disgusting. So if you're having vaginal discharge that is foul smelling, this could also be indicative of infection. And so we advise you to come back immediately so that you can be able to assess what could be wrong. So for me, these are 5 signs which mothers, grandmothers, aunties, cousins, whoever is near there, your husband is a part of this whole process. If we're able to pick these 5 signs for moms, then we should come back to the hospital for assessment so that we can take appropriate action. For babies, and this is where we, as Nest 360, our efforts on, there are several danger signs. If your baby refuses to breastfeed, that is a big danger sign. Come back to the hospital. If your baby is having difficulty in breathing, if your baby is breathing very fast, come back to the hospital. If your baby has a fever or is a little too cold, then you come back for review. If your baby is sleeping too much, then you also need to come back for review. So there, for me, those are the danger signs which we know, be able to pick problems and take care of them as quickly as possible. Back to you. Thank you.
Thanks a lot, Edith. Of course, these warning signs, the more you know about it, the more action you can take and really care for yourself and your baby. Now, during pregnancy as well, Neha, and I'm going to pose this question to you. What are the warning signs to watch out for? Can you talk a little bit about baby movements?
Yeah, absolutely. So there are a couple of things that there are quite a few actually that we tell women to keep an eye out for during pregnancy. And, like I work in an antenatal clinic, and I think often women will come in and they'll just not be confident about asking so many questions. But I'd always say that it's better to, anything that gives you even a little bit of stress, it's better to bring it to your healthcare provider, that even if you have a little bit of doubt. So there are baby movements is one of them. So what with movements, they will usually start in the first pregnancy, they will usually start around 20 weeks and beyond. It'll start as quickening, which is, this is the term we use for it. It feels like a flutter. and then becomes more regular as baby grows a little bit more in utero. And in subsequent pregnancies, it might start a little bit earlier, even as early as 16 weeks. And fetal movements are really important that they because they are a sign of baby's well-being. But what we usually will say is that mothers should become aware of how their baby moves, because what you need to look out for is changes in movement patterns. So when there's a reduction based on what your understanding of your baby's movement is when you should be concerned. So we will not tell them. I will usually not be prescriptive and say that your baby needs to move 20 times in 2 hours, but the baby needs to move how the baby has been moving and what is normal for you. And we do tell them that a lot of times when they start feeling like the baby is not moving is when they're in the middle, when they've been when they're in quiet and they feel like they really start to focus on it. So we tell them that, just keep an eye on it. And the other thing that I will always say, which I think is a bit of a misconception, is that a lot of times women say that when you're full term pregnant, you often cannot feel the baby move because the baby is too big. But the example that I always tell women is that baby obviously should not stop moving when you're full term. Baby should still move. But the example I'll always give is that, look, if you were in a very big room and you were dancing, you'd be able to dance with a lot more, you can move your limbs a lot more, you feed it a lot more. But even if you continue to dance in a closed box, you're still dancing. Those movements are still there. They just feel different. So we cannot say that if you're full term, you should not be able to feel your baby move, because that is one of the best and most important indicators of fetal well-being for us. That's around baby movements, but then also a few other warning signs to look out for. Severe abdominal pain is one of them. This can be very serious, especially if it can be preterm birth if it happens before your full term, or it could be a sign of any other pregnancy related serious challenge. Heavy vaginal bleeding, again, needs immediate medical attention. As Edith mentioned, postpartum headaches and visual disturbances are a problem, but they are also a problem in pregnancy because they can be a warning sign for preeclampsia. I've had women in my clinic who have literally been at the verge of having an eclamptic fit, and they've just said that, I can see stars around my eyes, and that's where we've just, referred them immediately. Swelling of hands, face, and feet, again, related to preeclampsia, very, very dangerous, and severe edema over the body. And another one, which times people are not aware of, is generalized itching, which if women say that they feel itching all over their body, especially around the palms and soles, we would often say that they should get like their liver markers checked and highlighted with their healthcare providers, because and this is something we see in our practice quite a bit, is it's when their liver enzymes are elevated. So this is something they see. So these are just a few of the things that women should look out for in pregnancy. Thank you.
Thank you so much, Neha. I'm going to narrate a comment that we received on LinkedIn from Fadila Ahmed. She says that I gave birth a few months ago, so everything being discussed resonates deeply with me, and I can relate to every bit of it, from the physical recovery to the emotional and mental changes. Also, it's such an important conversation that needs more awareness and support for mothers around the world. So thank you, Fadila, for that comment. It's really heartening to know that you're finding this conversation so useful. Now I'm going to segue to our next question, which is to Ulrika. Ulrika, are demographics of pregnancy changing in countries? Are there things women should watch out for if they're expecting at an older age or advanced age?
Thank you. Thank you so much. Yes, WHO, we acknowledge that the demographic of pregnancy, it is changing in many countries, with more and more women that are choosing to have their children at an older age. And older maternal age can be linked to a higher risk of complications, those that my midwifery colleagues here had talked about, such as diabetes during pregnancy, or high blood pressure during pregnancy, or even that the baby may come earlier than it was expected, that we call preterm birth. So that's why it's so important that all women, they go to their antenatal visits. And in many countries, this happens with the midwife. And especially if you are older, it's super important that you go early, immediately when you know you are pregnant, you go to your midwife or to your clinic where you can get antenatal visits. And then that you go for your regular checkups during the pregnancy. And some tips also to keep healthy during your pregnancy is that you think about your nutrition, what you eat, that we also heard our midwife from Trinidad and Tobago, that you also think about physical activities, that you take a walk or something, that you have regular physical activities. And that you also think about reducing stress and other factors that can affect you negatively. So those are some tips for I think it's even for all women, not just if you're a little bit older. Thank you.
Thanks, Ulrika. I will stick with you because the next question talks about WHO collaborations and guidance around maternal and newborn health. Can you help our audience understand what WHO is doing in this field with partners? So over to you.
Sure. Yes. So partnerships is really important for WHO. It's we have several partnerships, and within maternal and newborn health, we have something that we called Every Woman, Every Newborn, Everywhere. So EVINI is the abbreviation. And this partnership is supporting more than 55 countries all over the world to improve access to quality care that we heard also is so important. And to support countries to strengthen their health systems and to meet the sustainable development goals that many countries have committed for women and children. So the Every Woman, Every Newborn, Everywhere partnership is really focusing on supporting countries to provide quality care during pregnancy for all women everywhere, and that all women everywhere can have access to a skilled health personnel during labor. And there we have seen that a midwife is in many countries accessible and also a skilled health personnel. And of course, care after birth is also very important. So that is also something that we focus on. And of course, emergency care for women who experience complications. But then we, as WHO, we have also other partnerships, of course. So now we also work closely with UNFPA, UNICEF, ICM, and GPIGO on midwifery models of care. And there we have a position paper that we launched last year, the Transitioning to Midwifery Models of Care. And I recommend you all that are interested to read this paper. And currently we are working on the implementation guidance that we hope will be launched in May this year. So those are some of our partnerships when it comes to maternal health.
Thank you, Ulrika. It's fascinating to learn how much goes into, supporting mums and babies, and that so much needs to be done in this sector. I'm going to come to Deborah with one question. Deborah, what is, and maybe you're representing many of the midwives on this question, so what's one moment from your work as a midwife that reminds you why this job matters so much? Any special moment?
Yeah, there are probably so many, but I think for me, it's just that moment that the baby's born, and that the family is present, and just the joy of that experience when it can be a positive experience. I'll say to clients, I want you to be able to look back and say, maybe it was hard. I'm not saying it's easy sailing. Maybe it was hard, but it was a positive experience. And I think that's the moment that stands out most for me, is that immediate moment right after the birth, when the baby's just born, the joy and the emotion and the vulnerability and the transition and all of that.
Deborah, I'm going to ask another question. Not sure who from the panel could answer, but I'm still going to take an audience question. This is from Valentine on LinkedIn, and they're asking what policies are in place to ensure that pregnant women in war and conflict zones receive adequate care during pregnancy and childbirth. Would anybody like to take that question?
If you've been, or if Neha wants also, I know you are also very familiar with this one. Neha, do you want to start, and then I can continue?
Yeah, sure. I thought,
Yeah.
I think that would be best. So
Yeah.
I can talk a little bit about what ICM hopes to do for this. So we've really been doing a lot of work around how the role of midwives, specifically in conflict and climate disasters and humanitarian settings, how the role of midwives is just really essential because they are present in communities. They're part of the fabric of the community, and they can ensure the continuity of care that pregnant women need who are living in conflict or disasters. And part of the few things that we do for this, we work with associations, we work with midwives on ground to build capacity, work with in partnership with other stakeholders to build their capacity to work in humanitarian settings, but also work with midwives and associations to advocate for them to be part of the response network, because they need to have a seat at the table to be able to inform preparedness planning, to do disaster response, to understand early warning systems, to work with women because they really do get what the needs of women are in these situations. So equip midwives with what they need to work in humanitarian settings, give them that knowledge, give them that education, give them the resources, but then also help them be part of the response by equipping them with stakeholder mapping and just getting them to be part of the response fabric. And Ulrika, I'd love to hear what your addition is and what WHO says about this.
Thank you so much. As conflicts and crises arise, you're absolutely right, Neha, that this sector of work also needs a lot of attention to for women to deliver safely and with dignity, and hopefully there's going to be a more peaceful future as we tackle this topic. Now, the last question I have for all the panelists today. Can we end on one hopeful note? What can we do to ensure positive childbirth? Maybe one line each, if you have any reflection on this. Deborah, I can start with you, and then we can go to the other panelists.
Certainly. I think if we could fully implement the midwifery model of care throughout our healthcare systems, I think that would capture so many elements, such as respect for maternal, newborn care, etc. So fully implementing the midwifery model of care in our healthcare systems, public and private. Thank you.
Anybody else on that question? Edith?
Yes.
Smiling, so.
Yes, thank you. For me, I like the awareness model. Every woman, every newborn, everywhere. It means every mother, every baby. That component not being separated, and we as healthcare workers and policymakers and partners making sure that every woman and her baby everywhere are kept safe and they're both able to survive and thrive. So for me, I'm hopeful that that's going to happen. Thank you.
All right, Neha, Ulrika, one quick parting line about hopeful futures.
Sure. I can go first. So I think we just, again, talking about midwives, I think, I think about what I love about midwives is just how they approach the childbirth process, and, how they are just, like the word midwife means with woman, like how midwives connect with women through the childbirth process, how they hold them and how they carry them through pregnancy, through birth, through postpartum and beyond, and how we can to make that process better for women, we can just work very closely with midwives, get them what they need, invest in midwifery education and training, improve their working conditions, provide access to resources, supplies they need, so that it just strengthens how they serve the women that they work with.
Lovely. And Ulrika from WHO, any final words before we wrap up?
I think this session here today tells the story. Look at all these midwives from all the regions, or most of our regions, how knowledgeable they are, what kind of skills they have, and so I think they present the future for us, the midwives, because they work with passion. You could see how passionate they are, and they welcome all women everywhere. So I thank all the panelists, and I think they tell the story.
Thank you so much for today's live. I'm just going to take a few moments to recognize some of our audiences who've joined from USA, Mali, Senegal, Mozambique, Ethiopia, Nigeria, Singapore, South Africa, Egypt, Morocco, Bangladesh, Cote d'Ivoire, Mauritania, South Sudan, Pakistan, Rwanda, Gambia, Afghanistan, and the list goes on. So thank you so much for your active participation, and happy World Health Day, which falls on Monday. And with that, goodbye and have a lovely weekend ahead.
Bye.
Everyone.
Thank you so